We stay on this topic now, and as government rolls ahead with the NHI, are they ignoring its many red flags? Let's unpack some of these. We're joined by Discovery Health's Chief Executive Officer, Ryan Noach, this afternoon. Thank you very much for your time this afternoon, Ryan. And there are many red flags that have been talked about through the last few weeks as government rolls out the NHI. As someone in the health industry, what would you say some of these red flags are when it comes to the bill as it was passed?
Thanks very much for having me, Rafiwa, and good to chat. In the first instance, I should just make clear that at Discovery, we believe in structural reform in the healthcare system. We recognize that there are more than 40 million people in South Africa who don't necessarily have the appropriate access to high-quality healthcare. And we do recognize the inequality that exists in the current system. So it is our view that structural reform is required. Simultaneous regulatory change in both the private and the public sector is needed in order to improve access and equity. And in this regard, we've been quite constructive, Rafiwa. We've made various suggestions about models that could be sustainable. Your question about red flags is important. We are surprised that the Parliamentary Portfolio Committee approved this bill with very minor amendments, despite multi-stakeholder submissions and extensive input into the first version of the bill. They effectively ignored all that input and approved an amended version that looks very much like the first version. And the two key issues in our view are that they send a very negative message, firstly, to health professionals in South Africa. And we're working hard with health professionals to make sure they understand that many, many years will pass before there's any impact on them. But the sentiment within health professionals as a result of this bill is profoundly negative and worrying. And we've seen some negative statements emerging from multiple doctor groupings, including the South African Medical Association, the South African Private Practitioners Forum, and others. The other real concern from our point of view is Section 33 of the Act, which sets out that medical schemes, once the NHI is fully implemented, and there's some discussion around what that means, but at that point, medical schemes in South Africa may only allow top-up cover. What that effectively means is that this bill is proposing that the NHI becomes the single and only funder in South Africa for the majority of healthcare for all South Africans. Now, we've seen that this would land up creating a fund much larger, for example, than Eskom, probably R500 billion fund. And we think having a single fund managing all healthcare this way is perilous in many respects in our country.
That's quite concerning because the private healthcare sector has been quite vocal around its concerns at its exclusion within the involvement of the NHI. So one would wonder, as you give your explanation, as you just broke down there, was there enough engagement with the private healthcare sector, medical aid schemes, health insurance schemes about how it could be incorporated into what currently exists and what could be given to all South Africans, those who can afford some private healthcare, and of course those who can't, Ryan?
Yes, there was a process of engagement, and we've participated consistently throughout that process. I presented personally, together with my colleague, Dr. Ayanda Nsaluba, to the Parliamentary Portfolio Committee, and we submitted a 360-plus page submission setting out various thoughts and constructive suggestions to address the access and inequity issues in our healthcare system. We believe that an NHI will work. We're in support of a national health insurance fund, but just not as the single funder, not as a monopolistic funder. We believe in a multi-funded, blended model, and we think that significant health system improvement is required across the board prior to us being able to launch a national health insurance fund. So, to answer your question directly, engagement was there to some extent, could obviously have been better, but frankly, it feels like this has fallen on deaf ears. No change has been incorporated into the Act whatsoever.
So obviously there are reports that litigation is going to happen, and there will be court proceedings that will take place because of the current National Health Insurance Bill as it stands. And one wonders, what would be the ideal look of a national health insurance in a way that would benefit all South Africans and where all stakeholders, government, private and other stakeholders would be involved and benefit all South Africans equally and give them the quality of healthcare that the NHI was premised on?
Yes, you're right. Litigation does seem inevitable should the Act eventually be passed. And we should just pause here and recognize that there's still a long way to go before the Act is promulgated into law. And perhaps you want to talk about that a bit. This does not mean that the Act is in law yet. There's a long way to go there. But at the Parliamentary Portfolio Committee hearings, where multiple stakeholders presented, not only the private healthcare sector, various other stakeholders, civil society organizations, non-governmental organizations, there were a few of them that singled out that unless specific elements of the Act are amended, they intend absolutely to litigate. So it seems clear that if they proceed on the current path that they're on, there will be litigation. I should also raise the point that the Parliamentary Law Advisor, specifically in a written opinion on this Act that they wrote to the Parliamentary Portfolio Committee, raised constitutional concerns, specific legal concerns about the constitutionality of the bill. The Parliamentary Portfolio Committee, despite questioning from the opposition parties, it chose to ignore this opinion, and in their final report, quite strangely from my perspective, chose to annex the Parliamentary Law Advisor's opinion to the report from the Parliamentary Portfolio Committee along with the approved Act. And that seems strange to me because, frankly, the opinion is quite clear around potential constitutional risks. So that's on the litigation piece. The second part of your question revolved around what a sustainable model is. And in our work, we've done extensive global research. We've put together significant actuarial research and proposed a health policy centered largely around this NHI policy. So it is not radically different to this NHI that's been proposed at all. The main difference is that it's a multi-funded model as opposed to a single-funded model. And in this multi-funded model, the funding from private contributions and public contributions within the NHI is blended, so that there is some risk equalization component, so that risk is shared across these sectors. You know, coming out of the COVID-19 period, during which public and private collaborated so brilliantly, we think we should build on those partnerships and collaboration opportunities and ensure that in the future of South Africa's sustainable health policy, we have the best of all worlds participating, rather than really going just with a single funder and a public health system only.
Ryan, thank you very much for those insights, and obviously we'll continue this discussion as the implementation of the NHI, hopefully in its best form, is implemented in South Africa. That is Discovery Health CEO Ryan Noach joining us this afternoon. Still to